Hi, I am Dr. Krishna Chaitanya, Consultant General and Laparoscopic Surgeon, Medicare Hospitals, Miapur. Today we will discuss on a topic named Inguinal Hernia. So what is Inguinal Hernia? When there is a small hole or defect in your abdomen wall, the small intestine and the omentum, which is a fatty layer covering your intestines, they come out through that hole into your groin and into your scrotal sac. What causes this one? There is no place for the small intestine and omentum but to come out through that defect. What causes the increase in abdominal pressure? When there is constipation, the people will strain excessively to pass stools. This causes increase in abdominal pressure. Is there any other cause? Yes, like coughing violently, chronic cough like in tuberculosis patients, asthmatic patients, and some people have habit of sneezing violently and laughing violently. All these symptoms cause increase in pressure of the abdomen, and the small intestine and omentum will come out. Who will be affected? The age group, this can be seen from teenagers to elderly age group. The causes changes in elder groups. The poor muscular tone of the abdomen comes into the picture. In elderly males, the prostate also causes the hernia. How do you know you are having hernia or not? See, when there is a small swelling in your groin, whether it may be right, left or both, this swelling initially it will be very small and it will disappear automatically when you lie down or when you sleep in the night, and next day morning it won't be there. By the end of the day, the swelling will increase in size, or by when you strain for passing motion or when you cough violently, the swelling comes back. So these are the initial stages. Over a period of time, what happens means the swelling won't reduce, and you have to manually push with your fingers to reduce the swelling. And when it becomes complicated, then you will have pain, vomitings. What causes the complication like pain and vomitings? The small intestine or the omentum which gets into the hernia, they get obstructed, they get twisted, and they get gangrenous because loss of blood supply. So how to treat the hernia? This defect which is there in your abdominal wall, we have to close it to treat the hernia. For this one, we'll put a mesh which is non-absorbable, like it won't absorb and it will stay there for your life, and your body will grow a fibrous tissue over that mesh, and it becomes a strong wall closing the defect. This surgery can be done both through laparoscopic and open surgeries. In laparoscopic, the scar will be very small, like 1 centimeter only, and you will go home the next day. Well, in open surgery, the scar will be a little large, 5 to 7 centimeters, and you may have to stay for 2 to 3 days. Once operated, you won't have hernia in the same location again. So better get operated before it gets complicated. Thank you.